Hello and good evening, ladies and everyone joining us today. My name is Jelena and I'll be your moderator for today's webinar hosted by Europe IVF. Before we begin, just a quick note that for the quality of this transmission and to avoid interruptions, to protect your privacy, all participants have their microphones and cameras turned off. But you can still communicate with us throughout the webinar via the chat function. So just a click on a chat icon on your screen and you can send us your comments or your questions. Also, please note that this webinar is being recorded and we will send you the video to your email that you used when you registered on Thursday. So don't worry if you miss anything. Okay, so let me introduce today's key speakers, Dr. Folauf Irena, our experienced fertility specialist. She will walk you through the medical aspects of egg freezing, and Marija, our IVF coordinator, who supports patients like you from start to finish. Today's webinar is titled Egg Freezing, What You Should Know Before You Start. So we will begin with a short presentation by Dr. Folauf and followed by your questions by Q&A session where we will answer your questions that many of you submitted during the registration. You will be also able to ask questions live via chat, so we will prioritize those questions. Okay, and with that, I'll now hand over the screen to Dr. Folauf, who will guide us and you through the presentation.
Okay, thank you, Jelena. I'm Dr. Folauf. Nice to meet you. I really appreciate you to be here today with us. I would like to speak about social freezing, about freezing eggs, and also a little bit about IVF, in vitro fertilization. Deciding between social egg freezing and vitro fertilization, IVF, can be and should be complex. I hope that this overview will help you understand the differences, benefits, and the right timing for each option. I would like to speak about what's social freezing and who is it for, when is it time to move on to IVF, how IVF works after egg freezing, about common myths and concerns, and about frequently asked questions. Well, what is social freezing? Social freezing is a procedure for preserving your fertility. Why social? It's social because it's egg freezing doing without a medical indication. If you want to conceive later in your life for any reason, for example, because you don't have a partner yet, or because you want to have more control over reproductive timing, or because you focus on your career or your personal goals or traveling goals, this procedure could be an ideal option for you. Ideal age window for this procedure is between ages 30 and 35, when the quality of eggs is still good. Why? In my opinion, it's very important to understand that if we are talking about age and fertility, it's all about age of eggs. Our eggs are as old as we are, and when we are older, fewer and fewer of our eggs are able to do all of the complicated genetic changes after fertilization to turn into a healthy embryo and to turn into a healthy baby. And as we are older, it get more time to be pregnant, to get pregnant, and IVF success decreases, And unfortunately, the risk of miscarriages increases. That's it. And the solution could be social freezing. How does it work? For this procedure, you will need hormonal stimulation with injections to stimulate your ovaries to produce multiple eggs in one cycle. Then, approximately after 2 weeks, we can plan egg retrieval, egg collection, which is painless. It's under short whole anesthesia. It's safe because we do it under ultrasound control, and for the punction we use safe tiny needles. At the day of egg collection, our embryologists freeze and store all of your mature eggs, and that's it. Which are the benefits and limitations, of course? Social freezing gives women reproductive freedom without pressure. That's very important in my opinion. And you should also know that it doesn't guarantee pregnancy. Yeah, it only preserves the potential. And this procedure, it's less effective after age 38. That's because of the age of eggs. At our clinic, we have seen about a 50% increase in the number of social freezing cycles compared to last year. So it's, in my opinion, a clear sign that the interest is rising. When is time to move on to IVF? IVF is in vitro fertilization, and it means that we, or our embryologists, fertilize your eggs with sperms of your partner or husband, or with donor sperms to create embryos. And then, mostly after 5 days of the development, embryos are either transferred fresh into the uterus or frozen for later use. What's a huge advantage here at our clinic, in my opinion, is that we have all in-house. It means you can have all we need before the therapy and for the therapy here at our clinic. It means consultations, examinations, blood tests, ultrasound, and I'm also very glad that we have here also support from our colleagues, specialists in immunology, genetic, and also urology, if we need it for IVF, for example. There are 2 types of embryo transfer. Either fresh embryo transfer, it means that after about 5 days of development, embryo is placed in the uterus, or frozen embryo transfer when embryo is thawed and transferred in a later cycle. About statistic, at our clinic we perform over 1,000 IVF cycles per year, and our success rate is up to 50% per cycle. So it's nice. How does IVF work after egg freezing? Big advantage is that if you already have frozen eggs, it means you will not need the hormonal stimulation of your ovaries with injections, because we already have your eggs for fertilization. So we need to fertilize your eggs. And what's also very important is to prepare your uterus, your endometrium, for the embryo transfer. Because for successful embryo transfer, we need to have high enough endometrium with nice structure and good quality. Success rates are comparable to traditional IVF, so it's up to 50%. There are some common myths and concerns. For example, that frozen eggs only last a few years. That's definitely not true. For the freezing, we use very modern method of rapid freezing, vitrification, which is safe and gently. And because of it, we can store your eggs and also your embryos or sperms in a good quality for years. And about eggs, for example, there's a report case from literature when woman had a healthy child after IVF, when she used her eggs, which were frozen before, for 14 years. The second is that IVF is the last resort. That's not true, because IVF, in vitro fertilization, is a common, safe, and effective option. And the third, having frozen eggs guarantees pregnancy. That's unfortunately not true, because it's like everything in medicine, in the life, no method can guarantee the success for 100%. But what's very important, it can significantly improve your chances. And there are some frequently asked questions. What's the best age to freeze eggs? I have already talked about it. It's between 30 and 35, and it's all about and all because of the quality of eggs. How much does social freezing cost? And very often question is also if you can transfer your frozen eggs to the UK, for example, or to another country. For these two questions, can tell you something our coordinator, Marija.
Thank you, doctor. So regarding the cost of social freezing, the cost of social freezing in our clinic is 1,900 euros. And actually it covers function like of eggs, also freezing of eggs, and 2 years of storage. In this price, medication is not included. So medication can be both in your home country, UK. We cooperate with many online pharmacies for a long time. So it's not complicated to get medication either from us or from online pharmacies in UK. Regarding transfer or transportation of eggs in another European countries or UK, also, we have a lot of experience with this. We have transportation companies which we are cooperating with. All costs of transporting are individual. It depends on the city or depends on the country. So this question is like for each patient individually sorted from us. So we always support patients during the transportation. We give you all instructions how and where to ask for information in your country, and whatever you need, what kind of support from us, we will help with that.
Thank you, Marija. And the second question, the last question, excuse me. Why do women from the UK travel to the Czech Republic for treatment? It's because Czech Republic is a leading destination for assisted reproduction today, and we have high success rate and long-standing expertise. And it's also very important to speak about prices, of course. And in my opinion, here in Czech Republic, the prices are much more friendly compared to Western Europe. And what we can also say that Prague is a really nice, safe and historical city. So you can combine business with pleasure. That's it.
Okay, thank you very much, Dr. Folauf and Marija, for the great overview. And now let's move on to your questions. We've received several in advance, and we're also keeping an eye on the chat for anything that comes in live. So first question I would like to read is: Hi, I am 32 years old. I took the AMH test in October 2024 and the result was 1.5. There are no units, unfortunately. I would like to freeze my eggs in July. So this is something which is directly a request for freezing the eggs. But as I said, unfortunately, we do not have units for AMH level of this. So maybe it would be hard to make a comment on this.
Yeah. Okay, so in the case if this AMH level should be in units like nanogram per milliliter, I would recommend to do egg freezing as soon as possible because the AMH level is a little bit lower to the age as we can expect, yeah. And if it should be in nanogram per milliliter, we can expect about 10 mature eggs after the stimulation. So we can expect nice amount of eggs, but we don't know the units, so that's it.
Yes, I hope that the patient who wrote this will contact us so we can have a clearer picture about this. Okay, the next question is, am I too late in my 40s to freeze my eggs?
Okay, so as we have talked about before, it's much better to do the social freezing of eggs before, yeah. Under 35 years, it's optimal. But of course, if you want to freeze your eggs about 30, it's also possible. We can do it, but what you should know is that maybe you might need to repeat the stimulation, that maybe you might need more cycles and more egg collections to have enough eggs, yeah. Because for example, only according to statistic we know that, for example, that at the age 35 we need about 6 eggs, 6 mature eggs, to have one genetically healthy euploid embryo, yeah. And then, for example, at the age about 39, 40, we need about 11 mature eggs to have one genetically healthy embryo. And then after 42, 43, we need about 18 or more eggs to have only one genetically healthy embryo. Yeah, so you can see that it's really very important to start or to try as soon as possible.
Okay, let's move on to the next question. I'm 37 years old. Is this a good age to freeze the eggs? Which would be a lot of similar to the previous question. What is the limit age? That is what we already answered.
Excuse me, Jelena, maybe what we should talk about is there's no age limit, yeah? It's individual, like the ovarian reserve is individual, like AMH. But what I would like to say is that, for example, if we will do egg freezing about 38, 40 years old, and we will have enough of eggs, and in the future the patient will use these eggs for the fertilization and for IVF, I would recommend to do then PGTA, the genetic examination of embryos. It's also possible and we can recommend it.
Thank you. The next question would be how much it costs for someone that is 39 years old. So we said about the price, but also they should consider also that you mentioned that maybe they will need to repeat
that's it. Yeah.
It can be, price can be doubled in that case. Okay. The last question is interested in prices, how much time the process takes, and to end the medication procedure.
Okay. It's the whole procedure, the whole process is quite easy and quick. Yeah, it lasts about 2 weeks, maximum about 3 weeks. And what we need before is, of course, to know patient's medical history, and to have some results and examinations like AMH, that's the most important, anti-Müllerian hormone, AMH level, then some other blood tests, and of course the ultrasound examination. Then we can see how is the ovarian reserve, and then we can prepare individual stimulating protocol for each patient. And maybe I should also say that we should also know BMI before the therapy. It's also important.
Okay, so those were some questions which were sent by you when you were registering, and there is a last question, one from you sent us live. What is the number of eggs which is recommended to be stored for one person to have, let's say, 1 or 2 children in the future?
Yeah.
What is the approximate number of egg cells?
It depends on the age. Yeah. So if you are under 35, it's about 10, 15 eggs. If you are older, then it should be more. Yeah. Today, there are also some online calculators when you can fill in your age, your AMH level, and then they can tell you how much eggs you should have if you want to have social freezing, and if you want to have nice chances to be pregnant and to have 1 or more children in the future.
Okay, so that was the last question, last answer. Thank you all so much for joining us today. And as mentioned earlier, the recording of this webinar will be sent to you by the email on Thursday to the same email address that you used to register. And we'll also like to invite you to book a free introductory online consultation with us, with our IVF specialists, where we can discuss your personal situation in more detail. If you decide to book a consultation, please mention the code webinar25 to let us know that you attended. And on behalf of the whole team at Europe IVF, Dr. Folauf, Irena, Marija, and myself, I want to thank you again for your time, and we hope that we will speak to you soon. Thank you and have a
Bye. Thank you. Thank you for your time. Bye.